This motion, I just want to say this, which is important to go on record. That it is important for us to appreciate some of the things we are doing. And I'm hoping it's not on the chair, but also the whole committee. It is good if something is on the order paper, the committee to just, not the chair alone, because he's not responsible, but for the rest. Having said that, Mr. Speaker, allow me to support this motion on policy for the provision of mental health care services in all healthcare facilities in the country. Mr. Speaker, while I appreciate the Honorable Mishi for bringing this very important motion to this House, and looking at how our young people right now are really struggling, and not just young people, Mr. Speaker. I think every person today in their families, they have someone who is going through some mental health challenges, and not just for anything else, but stress. We've developed stress, and I know when you look at how life is today, many families will tell you why the young people are on the streets is because of stress, and in that stress, it pulls into that mental health challenge. Even in our ministries, and I remember when I was in the ministry, we had developed now a policy after COVID that we shall have a department for public servants so that they are able to go and just go for counseling, try and check yourself. That is why in Kenya, we have very many people suffering from chronic diseases. And the reason why we have these chronic diseases is because of stress. And we've come to realize as a country, it's not just about money. It is just that social setup. What is best for someone to be in a mental care, to find yourself without stress? Many of us I know will say, oh, we will need the money. You can have the money and you still have a problem on mental. And so to put it in every healthcare that we have, in fact, we have community health workers, Speaker, who we can train. Let them go in the homes. Let them visit homes. And these homes, when you start hearing someone how they are speaking, you realize why they are developing and finding themselves into mental challenges or disturbances or illness is because of just a few things that we are unable. That's why even our children, I'll tell you, Mr. Speaker, there is a young girl who will be buried maybe this weekend. And this young girl, the mother and the father were separated, yes, but at the same time had everything. But because of that, this girl went through a mental challenge until she decided to commit suicide when she's a university student. Today, Mr. Speaker, when you look at our universities, we've decided to take all the hostel. You know the days of privilege where you would walk into a university and it's the first time you are eating sausage? You know, it was in that, you know, there was some courtesy of now training you that when you are in this environment, you can sit on the table, you can have a meal, because maybe I've come from a family where we didn't even have the table to eat. Today we have subjected our students in an environment. When I look at Nairobi University, definitely you'll have mental stress because the hostel itself does not have curtains. The paint that was there during the time we were going to university is still the one. Nobody bothers to say you can even make it an environment. As much as the challenges are there, paint for them. Make it look a place where they'll feel, I have changed my life from the rural, I am now in a university. That is why today you find them wearing Crocs. Not that they don't want to wear shoes. They feel it's a lifestyle, fine. But look at the campuses that we have. Why won't you find your children into a mental stress? That we don't even want to make for them a place where we can call a dining, a kitchen where I can enter with my 5 shillings, but afford the food, and bring all the women who sell on the road that same food and tell them, we have now made a modern dining. You will be the one selling from the dining for safeguarding our students. Today, that is why you'll find some of them now running all over looking to how to survive. Why would they go through mental stress? We don't even have a health facility in the same universities to just help our students. And it has to change. The same person who is building the hostels, Kwetu and where, would have been given land in the university and be told, build it here. Let the students say, within the security vicinity of the university, but we shall have safeguarded many things. We've left them. Our university students from home is living in Githurai. Then the next thing, my son is in the cold in the morgue. I cannot question the university. No. As much as we are talking about this, Mr. Speaker, we must go back to where we started. We must bring relevance of why I am a student at the university. What is this that I have come to learn? How do I become a better leader, Mr. Speaker, if indeed I have gone through that hard life? How? How will I know goodness for my country? And that is what we are facing. That is why most of them, when you see them in the house, they will be on the phone, even your son, even my son, my daughter, because he or she feels, Mom, you are so busy. That is why when you listen to them at Eldoret in the music festival, we have very painful poems that are being said in that. You wonder, where are we as parents? Who are we? Look at the children that we gave birth in 2008. If you want to know, we really need these mental facilities and healthcare within our healthcare. Any Form 4 student today is a child that was born within 2008. You remember that time we had post-election violence? We have come, the same children, were the same children we decided we shall give them free laptops. We never gave them, Mr. Speaker. The same children came and find themselves in COVID, where they stayed home. There was COVID. The same children have gone for their school for 3 years, plus the days they will be for exams. I think some will be 70 days, some 77. So it means I have done my Form 4, 3 years, 77 days. I have finished my Form 4. Why would they have that challenge? That is where the government and the Ministry of Education should start thinking how they are doing the examination papers, so that we don't find our children feeling very disgruntled that it was during our time we had COVID, during our time we had floods, during our time we have a campaign where people did campaign and we were at home. All those things bring mental stress. And for us to change that, as I finalize, Mr. Speaker, is that we must support Honorable Mishi and to urge the national government through the Ministry of Health to collaborate with the counties and develop a policy to integrate mental health services in all. I would say the Ministry of Education should pick this and do it better for our children. With those few remarks.
Honorable Beatrice ELACHI, I thought this House had ceased to urge government. We had resolved that this House should be resolving or deciding. Why are we urging government?
I think, Speaker, you will forgive the House, and we will request in a very polite way the technical team, when they are processing, to ensure the word resolve and indeed, we must resolve as a House that the Ministry of Health will collaborate with the counties to ensure we develop the policy. With those few remarks, I beg to support.
Honorable members, for those who do not have this motion, I would request you look at it. It's one of the most important the House could be debating at this point in time. It's one motion that should engage the House very, very deeply and very actively. Honorable Mutunga?